Let's start by examining the needle holder. This is a ringed instrument. You'll notice that there are two rings in back, a ratchet, the shaft or body of the needle holder, the hinge, and then the jaws of the needle holder. If you look inside the jaws, you'll notice that there are serrations. This gives us better control over suture material and also various types of needles. Now let's look at the control methods for the needle holder. First, we'll start with the finger control. The thumb goes in the upper ring, the ring finger goes in the lower ring. The index finger goes on the body or shaft of the needle holder. The middle finger and the pinky can add stability to the lower ring. To open the needle holder in this manner, you will push forward with the thumb and push towards the palm with the ring finger, the middle finger, and the pinky. Notice that we have multiple points of contact on this needle holder. Now let's look at the palming method to control the needle holder. The upper ring goes on the pad of the thumb. The index finger will again be applied to the shaft or body of the needle holder. The pinky, ring finger, and middle finger will be applied to the lower ring. To open and close the needle driver using this method, push towards the palm with the pinky, ring finger, and middle finger, and oppose that pressure with the pad of the thumb. Let's look at some key points in performing the one-handed knot. First, we're going to cross our strand. This will set up our first two key points, the near strand and the far strand. If we look down at the strand, the near strand is the strand closest to me, and the far strand is the one further away. If I cross the strand the opposite way, the near strand and far strand just changed hands. Two other terms we want to be familiar with is the tying hand and the posting hand. The posting hand will provide upward pressure throughout this knot tying process. The tying hand will provide the throws. So in this demonstration, my left hand will be the posting hand and the right hand will be the tying hand. For the one-handed knot, you will tie and push with the same hand. Let's also look at this hand position. We call it the OK position. If you hold the strand between the index finger and thumb and let your pinky rotate in and hit the strand, then you're holding the strand in the correct position. Notice that the near strand is in my right hand and the pinky is now touching the near strand. The far strand in my left hand rotates over the three fingers. Now, let's practice tying this knot. Start off with the near strand in your tying hand, palm down. Now, rotate palm up. Let the far strand go over the top of your tying hand. Now, bend the middle finger and trap the near strand in between your middle finger and ring finger. Now, let go with your index finger and thumb. If you rotate your hand palm down and come through the loop, you have just completed your first throw. Notice that this knot will go down flat. To do this throw correctly, you will pull up with your left hand or posting hand and push down with your index finger of your tying hand. Now, let's identify which hand we should pull up with. If I pull up with my left hand or posting hand, notice that the knot stays in place. If I pull up with the other hand, notice that the knot has become unraveled. So, maintain your tension with your posting hand. I am currently pushing with my index finger. Next, I'm going to demonstrate the running locking stitch on the skin simulator. Notice that the first stitch has been placed and tied. Now, you'll start by elevating the far side so that you have clear visualization and pass your needle through. Now, you'll come over to the near side, elevate, and pass your needle through again. The key to the running locking stitch is to retrieve your needle always through this loop. Now, when you pull up, you will see the pattern that is created. Our goal now is to duplicate that pattern all the way down the wound. Notice the pattern that is created. We would continue this stitching pattern over the whole course of the incision.